Thank you all for being here today. My name is John Auerbach, and I'm the President and CEO of Trust for America's Health, also known by our acronym as TFAH, T-F-A-H. So if you hear TFAH, we're referring to Trust for America's Health. Well, today for us is a very exciting day. We will be highlighting the Promoting Health and Cost Control in States initiative and report, an initiative that has been supported by the Robert Wood Johnson Foundation and Kaiser Permanente. Today's briefing, though, is more than a focus on the report itself. We'll be highlighting the accomplishments and the opportunities that exist for policymakers and advocates and other key stakeholders to truly address the social determinants of health as a way of improving the health and well-being of the public. And the release of this report is very timely because there are many new governors as well as incumbent governors who are considering now what are the appropriate policies to focus on, to prioritize over the next few years. And this report is a tool that we think will be helpful because it curates a number of complicated policies and provides those that rise to the top in terms of their evidence base for both improving the health of the residents of their states and controlling costs. So today I want to begin, though, by initially offering some thanks. First, I want to offer my thanks to the Robert Wood Johnson Foundation, and in particular to Dr. Geert Tharmalya. Where's Dr. Malya? Thank you. Without the generous support of the foundation, we would not have been able to do the work in the PHACCS program. The acronym for Promoting Health and Cost Control in States is PHACCS. So we are incredibly grateful to the foundation for their support, and in particular to Dr. Malya for his skilled guidance through the development of this effort. Secondly, I want to thank Kaiser Permanente, which has been very generous in their support as well, and in particular, Dr. Choker and Kendall Stagg have been supportive of this work as it fits into a comprehensive view of health that includes high-quality health care and also important work that's being done in cities through the City Health Initiative. I want to thank our distinguished panelists, who you will be hearing from. They will be moderated by our wonderful Executive Vice President and COO, Dr. Nadine Gracia, and I will let Dr. Gracia introduce them right before the panel begins. And of course, I want to congratulate the inaugural recipients of the Advancing Health Awards, and those recipients are the Maryland Governor, Larry Hogan, the Rhode Island Governor, Gina Raimondo, and the District of Columbia Mayor, Muriel Bowser. While the governors and the mayor are not able to be here today, we're very happy that we will have distinguished representatives of their administrations who will be accepting the awards on their behalf and offering comments. Finally, and maybe most importantly, I want to thank the brilliant team at TFAH who have spearheaded the work on PHACCS. And those in particular, I'm going to ask them to stand up, are Adam Lustig and Marilyn Cabrera. Please stand. And Matt. Now, you have to know that when this started, the assignment that they soon had was to review 1,500 policies, 1,500, and read the evidence base for those 15 policies and sift through them to determine which best met the criteria of being useful for states, most effective in terms of improving health, and most effective in terms of controlling costs. So thank you both very much. Thanks also to Rhea Farberman and our terrific team in communications who really made a beautiful report as well as an informative one. So why do we need PHACCS? Well, Over the last few years, there's been ongoing debates, of course, about how best to guarantee that people have access to high-quality health care. And there's no doubt that access to high-quality health care is critically important in terms of health. But while it's essential, it's insufficient in terms of promoting optimal health for individuals and communities. Research has shown that numerous factors affect the health and well-being of the population and include many things outside of the control of healthcare. And they include the conditions in communities where people live, where they work, where they go to school, where they play. So focusing on those conditions and focusing on policies that can optimize the health conditions are critically important. We live in a country where $3.5 trillion are spent on health care every year, and a very small percentage of that dollar amount is actually spent on prevention. And yet prevention is critically important in terms of reducing healthcare costs, but more importantly, avoiding preventable deaths, illnesses, and injuries. The PHACCS report identifies 13 policies that have been definitively shown to improve health and reduce cost over a period of time. They include policies, for example, that are policies that support universal pre-kindergarten, school nutrition programs, clean syringe programs, earned income tax credit, and paid family leave. All of those have been shown to meet the very tough criteria that we've established in this initiative. Now, as you hear some of the 13, some of them might seem obvious to you as being health-related, the ones related to tobacco pricing, for example, or clean needle availability. But some of the policies might be surprising in their contribution to health, such as earned income tax credits and fair hiring practices. Yet, as the report highlights, there's solid evidence that these policies that are outside of the traditional notion of a health approach are important and effective in terms of improving the health of and well-being of the public. This is also an important moment because as the federal government is scaling back some of its efforts on health, states have an even more important role to play in adopting and implementing policies. And our work is intended to help. It's intended to provide supportive, useful information. It is not intended as a report card. Rather, it's intended as not only a helpful guide, but as a way of celebrating victories and honoring the people who are responsible for those victories, and, of course, assisting those who would like to have future victories in those policy arenas. In some of the instances, as we've looked at states and which ones have adopted different policies, we've noted that states have adopted policies which are consistent with the recommendations that we've made, and those are good policies, but we've also noted that in numerous instances, there are ways of strengthening even those policies, making the good policies great in those particular areas, and that's also part of the PHACCS approach. We also view this work as part of a continuum. This is not a freestanding initiative. This links up to many other activities that are taking place. For example, at the city level, as I mentioned earlier, there's the City Health Initiative that actually works on many of these different policies, but at a city level. At a federal level, there's great work that's being done by the Centers for Disease Control in advancing its High Five, or Health Impact in 5 Years initiative that looks at policies that can be adopted at many levels. The unifying characteristic of these different approaches is they're all science-based. They all highlight the evidence so that a busy governor or health officials in the states don't have to figure out where's the best place to invest our money if we want to see our money and our time. Sometimes it's not even money, it's just our attention. If we want to see effective outcomes. So we're part of that unified continuum. With that in mind, I do want to reemphasize every one of the 13 policies is one that is strongly based on evidence. The evidence is summarized within the reports, so if a state is interested in following through on pursuing one of those, the evidence is summarized, it's available, and if additional information is needed, we're there to help. With that in mind, I'd say that our work doesn't stop with the release of the report. Over the next 18 months, we'll be looking for additional ways to provide educational support and support through perhaps technical assistance for those states that are expressing an interest in the list of recommended policies. Well, now it's a great privilege to introduce my colleague, Dr. Girth Armalia, who I mentioned earlier. Dr. Armalia is the Senior Policy Officer with the Robert Wood Johnson Foundation, and he's going to discuss the importance of investing in upstream prevention efforts. Dr. Armalia is an accomplished public health physician and health policy expert. Prior to joining the foundation, he was the director of the Policy and Planning Office for the Philadelphia Department of Public Health, so he knows firsthand about advancing policy at the municipal level. At the foundation, he works to promote policies that help achieve a culture of health, one that fosters healthier people, communities, and institutions. Please join me in welcoming Dr. Girth Armalia.
Well, good afternoon, and thank you, John, for the wonderful introduction. I also just want to acknowledge John's visionary and collaborative form of leadership with the Trust for America's Health and his long career leading public health initiatives at the local, state, and federal levels. John and his team at TFAH are just such a pleasure to work with, and they're a key partner of ours in helping to build a culture of health in this country. So thank you for all that you do. I also wanted to recognize, as John already mentioned, the TFAH team that put this report together. You already heard about the Herculean effort that they went through. I just wanted to say that you all demonstrated a really consistent commitment to elevating the best science, promoting health equity through this initiative, and really considering all different aspects of feasibility as states confront the huge challenges that they do face as it relates to health and well-being. So thank you also for the tremendous work. And lastly, I just wanted to thank Kaiser Permanente as well. They were a co-funder and a co-strategist on this initiative, and whenever we get a chance to work together, I think good things happen. So looking forward to the next opportunity. I wanted to pick up just on a couple of themes that John already mentioned. From the perspective of our foundation, the Robert Wood Johnson Foundation, talking about the importance of states, the role of public policy in promoting health and well-being, and lastly, next steps, as John touched on. First, states are really critical in advancing solutions to promote better health and positive societal returns as well. They're known often as laboratories of democracy, and it's really where ideas can be tested, refined, and even put to the side when we find out that policies don't deliver on the promises that they set out to meet. With the challenging policy climate we face federally, states are increasingly looked to, as John mentioned, to take action. States also have significant authority, which we'll probably hear more about over the course of this afternoon. They set budgets, they raise revenue, they act as funders and implementers of large federal programs like Medicaid and state and local programs like K-12 education. And they really can either promote or inhibit local innovation as well. And now is a key moment. The November elections brought in nearly 20 new governors and thousands of new state legislators. And they are ready to address their state's biggest and most pressing challenges. And this report says that if you care about health and well-being in your state and you want to make sound investments, here's where to start. The particular policies that you may choose may be different than your neighboring state or a state across the country, but these are the policies that we think are the best bets for promoting health and well-being in your jurisdiction. So the second point is just on the importance of public policy. We at the Foundation, and we know that the Trust for America's Health as well, believe that public policy is critical to promoting better health. Laws and regulations have broad reach. They affect entire populations. They hold the promise of longevity if they're implemented and enforced correctly, so they have durability. And then lastly, we know that public policies can help change our norms and attitudes about what it takes to be a healthy society and a healthy community. The last point that I don't want to underemphasize is that many of the inequities that we see in this country today were created through policy. Just think about the long history of redlining or the continued racial discrimination that happens in mortgage lending and housing rental practices. So if we want to reverse those inequities, we're going to need policy to be part of the solution. The last thing I want to mention just in terms of next steps is that there will be crucial work that needs to happen in terms of adoption of policies to help state leaders understand what their options are, connect with other state leaders who are maybe considering some of the same strategies, and helping them engage residents and stakeholders all across their states in policy design. There's the important phase of implementation. I want to harken back to equity. We know that many policies that on their face are equity promoting often don't deliver when it comes to implementation. One example of that, a policy from the report, is paid family leave. Even if paid leave laws provide a pretty high wage replacement rate and offer job protections for workers, we know that low-income workers are much less likely to use those benefits. They may be less aware of them, they may have challenges navigating the system to claim the benefit, and they may fear retaliation from their employers. So the equity rubber really meets the road when we get to implementation. Lastly, I'll say that we know a lot about these policies. We have 90 pages and over 600 citations to stand with that statement, but there is more to learn. For example, with earned income tax credits, they clearly have impacts on infant health, but do they affect child health later in life? Similarly, with preschool, what policies and practices are essential for making sure that educational gains that are made in preschool carry over into the K through 5 space, particularly for disadvantaged children? These are the types of questions that we collectively need to keep answering. So as we do take these next steps, it's going to be critical that we partner together. Many of the groups represented in this room and many others, because ultimately we do see that this is a collaborative effort to turn these recommendations into a reality. Thank you all for being here, and I'm looking forward to the discussion.
Well, now we're very pleased to actually recognize leaders who have implemented many of these policies. And to do that, I want to invite Adam and Marilyn up to join me. I've worked, over the course of my career, I've actually worked for 4 different governors, 2 on the Democratic side of the aisle, 2 on the Republican side of the aisle, and I've worked for a mayor. And I know just how hard it is to adopt a policy, to sift through the policies, to figure out which ones matter, and then to make sure they are both passed and then implemented well. So we're going to be recognizing some real leaders and trailblazers that I think can set examples for others in terms of how do you approach the policies that we're looking at in the PHACCS initiative. To do that, we created an award, a new award, which we'll be giving out in the future as well, that we refer to as the Advancing Health Awards. And these awards recognize the achievements of governors and the mayor of the District of Columbia in supporting policies that improve the health and well-being of their residents. The people that we're recognizing today were selected because they've already adopted most of the policies that we're highlighting within the PHACCS report. And as such, they're really the exceptions there and quite noteworthy. So first, I'm pleased to present the first Advancing Health Award to the District of Columbia's Mayor, Muriel Bowser. In the PHACCS report, we identified that the District of Columbia has enacted policies addressing all of the 13 recommended policy areas. And specifically, we want to acknowledge Mayor Bowser's support for increasing the cigarette tax by $2 last year. And that increased the per PHACCS tax to $4.50. That made it, in fact, the highest state tax rate in the country. The District of Columbia also leads the nation in access to pre-kindergarten, serving 88% of the district's 4-year-olds. Similarly, the District of Columbia ranks first in the country for funding for pre-kindergarten, spending almost $17,000 per child. Accepting the award for the mayor is Deputy Mayor of Health and Human Services, Wayne Turnage. Mr. Turnage serves as the manager of the agency and chief advocate for the annual legislative and agency budget priorities, and he works closely with both the mayor and city council to address the concerns of Medicaid stakeholders and the citizens of the district. Please join me in welcoming Mr. Turnage.
Good afternoon. It is both an honor and a privilege to be here today and accept the Advancing Health Award on behalf of Mayor Muriel Bowser. This award from Trust for America's Health is especially gratifying to the mayor because of the near-perfect synergy between the mission of this organization and Mayor Bowser's focus on health and wellness for district residents. Quietly, Washington, D.C. is becoming that much-lauded shining city on the hill, with more than 700,000 residents and a number that is growing by nearly 800 per month. The district is growing because people are recognizing its value as a diverse and inclusive city, where its leaders care about building a sustainable and healthy environment while displaying an absolute passion and a drive for fairness and equity. It is because of the commitment of Mayor Bowser and the city's forward-thinking leadership that Trust for America's Health has identified the District of Columbia as having enacted the highest number of evidence-based policies recommended to improve health and wellness. Certainly, like all big cities, there are significant and vexing challenges that remain. But today, because of our growth and the mayor's commitment to fairness, equity, and the health and wellness of our communities, the district is now better positioned more than ever before to build healthier, safer, and stronger neighborhoods all across the district's 8 wards. Many of the 13 evidence-based strategies recommended by Trust for America's Health are reflected in the 3 themes which frame much of the health and human service work that is annually prioritized in the mayor's $14 billion annual budget. Notably, through this budget, the mayor focuses on addressing the very challenging problems of homelessness in our city, improving the quality of life for our seniors, and supporting with deep investments children and families with a special focus on ensuring access to health care services and developmental services for our young kids. With respect to the issue of homelessness, Mayor Bowser has made the goal to make homelessness rare, brief, and non-recurrent. And we are well on our way to achieving that very challenging goal. As health professionals, we know that housing is therapeutic in and of itself, and with the stability of housing and a foundation, people can achieve greater health and wellness. This is why Mayor Bowser has made unprecedented investments in permanent supportive housing and other programs that are proven solutions to battling chronic homelessness. The mayor has increased our annual investments in these programs by more than 60% over her tenure, while delivering in a big way on her promise to close the D.C. General Family Shelter, once the largest family shelter in the country. This rather unsuitable venue for families has been forever replaced by dignified, modern, and short-term family housing programs designed to lift families out of homelessness and back into stable housing. In support of this goal, the mayor opened the first 3 new short-term family housing programs this past fall in wards 4, 7, and 8, and we fully expect more projects to come online over the next 2 years. Additionally, we will soon begin renovation, or after a demolition, a reconstruction of a $40 million men's shelters project on 801 East, at 801 East that will be service-rich, 24 hours in terms of its tenure, and designed to keep people safe and moving forward towards greater health and stability. Because of these type investments, we have reduced family homelessness by 40% since the mayor took office, and we've decreased overall homelessness by 17%. Those numbers are unparalleled anywhere in the country. Likewise, the mayor has and will continue to make big investments in our seniors and older adults. Through what is now her widely known Safe at Home program, Mayor Bowser is allocating resources to give many seniors the opportunity to live safely at home rather than relying upon institutional care. This fiscal year, the mayor made $16 million in total investments in Safe at Home to provide for much needed safety adaptations in and around the homes of those of qualifying seniors and adults with disabilities. As a result, we now can say that there are more than 1,000 seniors with home adaptations that are now allowed to live comfortably in the privacy of their cherished homes rather than having to rely upon nursing home care. And we are looking to continue investments in D.C. senior wellness centers. These are important areas of socialization for our seniors. We are already spending $16.9 million across the city, including a new center planned for Ward 8. This effort will soon be expanded with an upcoming project in model cities and Congressional Heights Wellness Centers. Finally, I want to draw your attention to the mayor's work in strengthening families and investing in children. This is some of her most robust work. As a part of her focus on this issue, Mayor Bowser works through the agencies and the city's Health and Human Services cluster on many key initiatives that are designed to enhance the well-being of all residents, but especially those who live in the east end of the city, where one can sometimes make the argument that there are a tale of two cities. We are most proud of our investments, which placed the district, as was stated, first in the nation, now for a 3rd consecutive year in pre-K investment. Our spending on pre-K at almost $17,000 per child is almost four times what you would see spent at the national average. This is our attempt to significantly intervene in the lives of our children during the most important time of their maturation. But we also focus sharply on health equity. Disseminated through the mayor's recently released Health Equity Report, the mayor has outlined a roadmap of strategies to guide the district's efforts in addressing the social determinants of health. These are factors that must be fully understood if we hope to work and overcome and make the district a much more healthier population. For example, because we know that healthy women make healthy babies, reducing preterm births is a major focus of this effort, and it has a direct impact on population health. Recently, Mayor Bowser hosted the inaugural Maternal and Infant Health Summit, and it drew leaders and experts from all around the nation to discuss the strategies that hold the promise of reducing disparities in birth outcomes, especially in the east end of the city. And as a part of this effort, the mayor funded a $1.6 million program directly to reduce preteen births. Still, we recognize that continued investment is needed to reverse the deeply entrenched inequities that we see in maternal health outcomes and other health disparities between the East End, the residents of the East End, and the balance of the city. Also, the mayor fully understands that if the city is to experience the long-term prosperity that is her design, access to quality health care is absolutely critical. We need our residents healthy and working to foster continued economic growth. Accordingly, the mayor is working in this term to secure the necessary agreements to develop a fully integrated healthcare system for the residents of Wards 7 and 8. On average, these residents have the highest morbidity rates in the city. Some numbers are shockingly high. Yet they lack convenient access to the urgent specialty and hospital care that many of us take for granted. And this is absolutely critical in the proper diagnosis and treatment of disease. We will rectify this problem. Most importantly, thanks to the investments by Mayor Bowser and the development of regulatory policies that promote affordable health care insurance, DC can boast of one of the highest insurance rates in the United States. Fully 97% of all district residents have either commercial or publicly funded health insurance. That places the district second in the nation. On publicly health care funded programs alone, we spend $3 billion per year to provide a full range of primary, secondary, tertiary, and quaternary care healthcare services through an array of clinics and hospitals. And finally, the mayor recognizes that in addition to the access to health care, we must continue to focus on the overall health and well-being of our residents by implementing policies that prevent chronic diseases through access to healthier food choices while discouraging the harmful use of tobacco products. The recent increase that was referenced in tobacco taxes is just one example. We are taking additional steps in the district to ensure that the benefits of increased taxation accrue to health programs by investing in maternal and child health programs like home visitation. As the mayor begins her second term, these are the type of investments that she will continue to make, ensuring progress towards her goal to transform the district into the healthiest city in the nation, keeping it perfectly aligned with the ambitious goals of Trust for America's Health. On her behalf, I thank you for this wonderful recognition and honor.
Well, thank you very much for those comments and for the terrific work you're doing. Now I'm pleased to present the Advancing Health Award to Governor Gina Raimondo of Rhode Island. In the PHACCS report, we identified that Rhode Island has enacted 11 of the 13 recommended policies. And specifically, we'd like to applaud Governor Raimondo for signing legislation last year to prohibit the use of electronic cigarettes in most indoor workplaces and public places. Additionally, the governor's support for earned sick leave demonstrate her and Rhode Island's commitment to ensuring that individuals can recover from illness or care for family members without fear of losing wages or their jobs. Rhode Island is also one of only a handful of states to have enacted paid family leave. Accepting the award for the governor is Rebecca Boss, the director of the Department of Behavioral Health Care, Developmental Disabilities, and Hospitals in Rhode Island. Ms. Boss was confirmed in May 2017 as the director of the Rhode Island Department of Behavioral Health Care, Developmental Disabilities, and Hospitals as the governor's appointee, and she served in that position as well previous to that as the acting director. So please join me in welcoming and congratulating Director Boss.
Good afternoon. My apologies in advance for running out the door. After I received the award, I've got a flight that I need to catch, but I am very honored. Thank you, John, and members of the Trust for America's Health for bestowing the Advancing Health Award to Rhode Island Governor Gina Raimondo. On behalf of the governor, I offer thanks and appreciation for recognizing the work that is being done in Rhode Island. Our governor shares the mission and vision of the Trust and works every day to promote the best possible health and well-being for all Rhode Islanders. As the director of the Department of Behavioral Health Care, Developmental Disabilities, and Hospitals, one of the longest names that we have, I can attest that both medical and behavioral health care promotion are cornerstones of her administration, as is a focus on the socioeconomic and environmental determinants of health. We know that an individual's health is largely determined outside the doctor's office and inside our homes, schools, jobs, and neighborhoods. Our Rhode Island Department of Health, under the direction of Dr. Nicole Alexander Scott, supports 9 health equity zones, or HEZs, in communities across the state. Through a collaborative community-led process, each HEZ conducts a community needs assessment and implements a data-driven plan of action to address conditions that are preventing people from becoming as healthy as possible. The department provides support to ensure the model is successfully implemented in line with the core public health principles. Some of the HEZs have become very involved with my department's community prevention coalitions. The 2 groups meet regularly to collaborate on their community service delivery systems, and they've worked together on prevention needs assessment surveys, which are a critical component in our efforts to engage communities in primary prevention and recovery support services. In Governor Raimondo's 4 years in office, she has enacted, I had 9, but you said 11 of the 13 evidence-based policies that the Trust has shown to improve community health and well-being. I won't discuss them all, but some of the governor's accomplishments include requiring all public schools to operate a school breakfast and lunch program, and it's working quite well. Every day, 29,000 children receive a school breakfast and 76,000 children receive a school lunch. Syringe access programs are administered by the Department of Health through the Encore Needle Exchange program, which allows outreach workers to meet people at risk in the community and make sure that they have clean supplies. Tobacco-free laws were just mentioned. My department holds the contract with the Food and Drug Administration to determine tobacco retailer compliance with the federal law prohibiting the sale of tobacco products to underage individuals, and we're the state agency responsible for enforcing a similar underage access law. By limiting the sale of all tobacco products, we hope this will protect our children from tobacco and smoking addiction, nicotine harms to brain development, and other health risks to heart and lung function. Additionally, 2 years ago, the governor signed a law which added electronic nicotine delivery systems, known as e-cigarettes or vaping devices, to the state's smoke-free schools law. Our statewide network of regional prevention coalitions has done training for students, school personnel, and parents on the dangers of teen use of e-cigarette or incognito vaping devices. These concerted efforts will also help the state and individual communities address the national and local epidemic of underage kids and teens using these highly addictive nicotine products. Last year, e-cigarette and vaping devices were added to the state's smoke-free workplaces law to protect secondhand bystanders from the harmful chemicals in e-cigarette aerosols. And while talking about epidemics, the opioid epidemic is one that is affecting Rhode Island as it is affecting individuals across and states across the nation. I was just recently with my colleagues from other state departments at the National Association of State Alcohol and Drug Abuse Directors. And I'm very proud to say that Rhode Island is held up as a model of the work that we've done in terms of addressing the opioid epidemic. And that really is a result of the strong leadership of the governor, developing a strategic plan guided by expert advisors that allows us to implement innovative programs that are saving lives. One of those programs is the implementation of medication-assisted treatment, all 3 forms of FDA-approved medication-assisted treatment to treat opioid use disorder in our Department of Corrections for individuals both in the jail and the prison, resulting in an over 60% decrease in overdose deaths in that very vulnerable population, the results of which have been published in JAMA Psychiatry. Also, recognizing the connection between education, employment, and community health, Governor Raimondo's Rhode Island Promise provides incredible opportunities for Rhode Island youth. This program, which provides 2 years free tuition for Rhode Island youth entering community college, has more than doubled the number of low-income students and students of color enrolling full-time. Governor Raimondo's support for these initiatives that promote health and well-being for all Rhode Islanders is continued and expanded upon in this year's proposed budget, which includes expansion of Rhode Island Promise to cover the last 2 years of tuition in our 4-year institutes of higher education to ensure that no Rhode Island student leaves college or is prevented from graduating due to an inability to pay. Her proposed budget also includes increasing services to address the mental health needs of our students in public schools and universal access to quality pre-K. And here's a direct quote. Every 4-year-old in Rhode Island ought to have a chance to be able to go to public pre-K. You shouldn't have to be lucky. You shouldn't have to be wealthy. It should be a matter of right. And so it is my sincerest thanks on behalf of Governor Raimondo for recognizing the work that she is doing toward our shared goals to ensure a healthier society. I am so proud to work for such a brilliant and progressive woman. Thank you very much.
Thank you very much. We're inspired by the work that's going on in Rhode Island. That's great to hear. And finally, we are very pleased to announce one of the recipients of this year's awards is the Maryland Governor, Larry Hogan. In the PHACCS report, we've identified that Maryland has enacted 10 of the 13 recommended policies, and we specifically applaud the governor and the state for eliminating the minimum age requirement for the state's earned income tax credit. And that effectively expands the eligibility of the program to young workers throughout the state. Additionally, the governor's support of the Hunger-Free Schools Act of 2017 allowed more high-needs schools in Maryland to provide free school breakfast and lunch to all students, and it was an important step in ensuring that more students have access to the nutritional meals that they need in order to be healthy and to learn. Today, we're delighted that we're joined by Secretary Robert Neal of Maryland, who is accepting the Advanced Health Award on behalf of the governor. He is a renowned and experienced public health servant for more than 40 years, and the Secretary has served as a senior advisor to the Hogan administration since 2016, focusing on agency efficiency improvements, greater accountability, and performance benchmarks for the residents. So please join me in welcoming Secretary Neal.
Thank you, John. On behalf of Governor Hogan, thank you for your cordial invitation, and thank you for the award that I'm going to try to take back. I do not have a flight to catch, but the General Assembly is deliberating on my budget, and I have to get back to Annapolis before they discover I'm missing. So, little self-defense there. First of all, thank you very much for recognizing our state. Maryland's been at this a long time. I'm an old-timer. I was present at the birth of the all-payer system in 1977, which has served the state well for 42 years. And we've been in the public health business a long time. I'm going to talk about just a couple of things, and I want to talk about something forward-looking rather than looking back. The syringe service program actually got its beginning 25 years ago. And if you think that this is just science-based stuff, you're mistaken. There's really a lot of politics involved in this. And when somebody introduces a bill that allows you to distribute syringes to people who are addicted, a debate ensues. And I was part of that debate. And we really started as a pilot in Baltimore City, and it is now spread to about 6 counties in earnest, and I think we have another 6 that are developing this program. The evidence is compelling. It saves a lot of money. Forget the human misery that it prevents, but it really does save money. These are communicable diseases, and this is very important to try to get a handle on. The smoke-free issues was really something uniquely Maryland. Tobacco was the coin of the realm. It was actually Maryland's currency for almost 200 years. When you got paid in pounds tobacco. When you paid your taxes, you paid it in pounds tobacco. Some of the decor in our beloved 1772 State House are gilt tobacco leaves. So this was not an easy task, and to change that kind of history. It took place over time. Taxation was a part of it. Smoking cessation was a part of it. But Maryland took a comprehensive approach. We had tobacco farmers who were making a living producing tobacco. So we had to come up with, and we used some of the money for crop conversion strategies. So a lot of the places that were tobacco fields, for as far as you could see, they're now growing flowers, and they're growing custom vegetables and lots of other things. But it was because it was such an important part of our economy, we had to do something about that as well. Right now, if you're 10 years old in Maryland, you've never been in a public place that had smoke. And so when you look back, and you need to sometimes, just to see how far you've come, and yet we still have a great deal more to go. I'm very concerned about electronic cigarettes and juuling, or whatever it's called. I think it's a new problem, and we're going to have to tackle it exactly the same way that we tackled tobacco. The evidence, again, is compelling. Lung disease and lung cancer is down substantially since our long-term effort to defeat tobacco, and more is needed to be done. If I could just take a couple of moments to talk about what I think is one of the most exciting developments since my entry into public service in 1971. The governor, Governor Hogan, signed an agreement, as well as me, with federal government to do a total cost of care model. Now, there are some of these things going on around the country, but we are attempting to transform our entire state health system. No mean task. Dr. Howard Haft, stand up, Howard, is a former Deputy Secretary for Public Health. He is superintending the primary care conversion. We have 400 large primary care physician practices that are going to be undergoing a soup to nuts transformation, which should revolutionize the way healthcare is delivered in Maryland. We're working with the hospitals and every other component of the continuum of care. And of course, we're doing it for Medicare because that's what the deal was. But we're not going to convert just for Medicare. We're going to transform it for everyone. So if you have a spare moment, or if you are morbidly curious, you ought to give what we're doing an occasional look, because I think some very special things are going to happen in Maryland, which I think are going to be applicable in other parts of our great country. So thank you so very much for having me here. Thank you for allowing me to bring something home so that I might keep my job for another week or two. And I look forward to working with all of you to see if we can't pull this off.